Health, according to World Health Organization, is the complete state of physical, mental, and social well-being of an individual. Though you might say that health is not everything, but the truth remains that everything is nothing without health. Therefore, for anyone to actively participate in all fundamental aspects of life, there is need for us to ensure that healthcare services are made affordable, available, and accessible to all. Hello, my wonderful viewers. Once again, you are welcome to the program Arise and Shine. I remain Stephen. Today, we are going to discuss healthcare services and how accessible is it to persons living with disabilities. Don't forget to like this channel, subscribe to it, turn on your notification bell so that you don't miss out any of our editions. Remember to share so that others will see it. Let me once again use this opportunity to appeal to our excellencies who are here to adopt and domesticate the Discrimination Against Persons Living with Disability Prohibition Act to please do so. For this is the only act that can ease the effective integration of persons with disabilities into the society. Like I told you, today we are going to discuss healthcare services. How easily accessible is it to persons living with disabilities? When you talk about health and healthcare services, it is something that is very, very important to everyone that is living here on earth. But we want to narrow our discussion to persons with disabilities. You will agree with me that no matter how beautiful a building is, how highly equipped the hospital is, if it cannot be accessed by persons that it is meant for, then it is as good as non-existent. Apart from the factors that are found within the medical sector, there are some other factors that tend to affect persons with disabilities when it comes to accessing hospitals, clinics, or health centers. And these factors tend to include social factors, economic factors, and environmental factors. We're going to look at these factors one after the other and see how it affects persons with disability, or how it hinders them from accessing medical facilities, and what we need to do to eradicate such hindrances. First of all, let's talk about access. When we're talking about accessibility, people will think we are emphasizing on this too much. But it's one of the major problems that is faced by persons living with disabilities. Difficulty in accessing public facilities. When it comes to a healthcare center, for one to be able to be attended to in a hospital, a clinic, or a health center, that person has to be able to enter the building first. And so access to the building starts from the road network. For instance, in rural areas, we have a very poor road network. And when the road is not smooth enough, it affects the movement of persons like people on crutches, and also persons on wheelchair or people that use walkers. Why I mention this particular set of people are they are the ones that feel this impact most. Other people can meander their way easily, but these three sets of people find it very difficult to move on areas where the road is not well constructed. And so this accessibility we are talking about must start from the road network. Then we now come to the compound itself. Entrance to the compound. Like I used to say in my program, that when the entrance to the compound looks like a hill, it is almost impossible for a person with disability to access that compound. So the entrance to the gates of every compound must be made to be reasonably flat. It should be, if the compound is higher than the main road, then it should be constructed like a ramp, so that wheelchair can flow in and flow, and people on crutches or walkers can easily access, because it is difficult for this set of people to climb stairs no matter how small that stair is. They will now come to the building itself. I know that hospitals have ramps because they normally use it for their stretchers and all other things, but some ramps are hair-like in nature, and so ramps in our hospital should be made to be reasonably normal, so that it can allow easy flow of waste and other movements without anyone needing extra help from any other person. You don't need to involve a third party to be able to wheel a wheelchair on a ramp. But some ramps are so constructed that they are almost like hill, that one cannot easily manipulate his way through it without calling for a third party. So when we are talking about ramps, this thing should be constructed to make it reasonable enough to allow easy flow of waste in and out of a building. Then when you come to the hospital itself, some equipment that are used in the hospital should be made to be reasonably low, like the examination bed, so that people with disability can easily mount on such things. Another area that we should need to look into is the area of personnel, health personnel that are trained in disability issues. That tends to pose another problem, because from experiences and complaints we have been getting from people, it seems to look like our medical personnel are not well trained as to how to handle persons living with disabilities, because we have persons with disability with special needs who really need special attention, and those, and thus they, it needs a personnel that has the patience and understanding to handle such cases. Also, there is need for there to be auxiliary staffs and devices that will aid the treatment of persons with disabilities. For instance, if somebody who is hearing stroke speech impaired comes to a hospital, there is need for a sign interpreter to be around, so that it will be easy for the doctor to examine the patient with good understanding, because when there is no communication, the doctor might not be able to know what is actually wrong with the patient. But with the help of a sign interpreter, both the doctor and the patient can communicate effectively, and the work will be easier. Our hearing stroke speech impaired friends has always complained that whenever they go for antenatal clinics, they find it difficult to understand what is being taught, because the method that is being used is the voice method, and so they cannot hear or understand anything. They leave the clinic with little or no information at all. Such a scenario would have been avoided if there is provided a sign interpreter, or the information is being displayed for them in a written format. That would have gone a long way to ease that problem. And that is why it is very, very important that auxiliary method must be applied to carry along such particular set of individuals. Information should be provided in accessible formats that is suitable to every form of disability. Visual display equipment can also be used, apart from sign interpreters, to display information so that persons who are hearing stroke speech impaired can easily read and understand. Although I know there are some hearing and speech impaired persons that are not that educated, that is why persons that are grounded in issues of disability should always be around, so that whatever form the difficulties or challenge comes, they will know how to maneuver it. For visually impaired persons, audio equipment should also be used to pass information and also provide information in braille formats. For example, when you buy medicines, the instruction leaflet inside the medicine, there is nothing wrong if it is written in both normal plain English language and in braille format to aid persons with visual impairment to be able to read without assistance. Yeah, this is what our pharmacists should take note of. Take note. Our pharmacists should take note. Those that are in charge of producing medicine. There's nothing wrong if they should be providing the names of the medicine both in written form and in braille format, so that anybody can access it, both the leaflet and on the carton itself. The name of the medicine carved in braille and the instructions in the instruction leaflet also cut in braille, and this will make life easier for everyone. Another area where persons with disabilities have problem in accessing health facilities is the area of finance. The area of finance. You will agree with me that for you to have a quality health care service, it needs money. And persons with disability are average persons in the society. Most of them are living in poverty. And so going to hospitals becomes a luxury. So I will advocate that our government should make healthcare for persons living with disabilities free, 100% free. Yes, free quality healthcare service for persons living with disability. That's what I am advocating. That will make it easier for persons with disability to access medical services without thinking of the burden of payment. Health is very important because it's the prerequisite for everyone who wants to achieve anything in life. You have to have a good health and you have to be sound in mind and alert. And without a good healthcare service, one cannot achieve this. So I call upon the government to make our hospitals accessible, affordable, and available so that life will be easy for all of us. Don't say that it doesn't concern you. It concerns everyone because the good unto one is the good to all of us. If you make life easy for me, you are as well making life easy for yourself. No one knows tomorrow. If it's not you, it might be somebody close to you. So let's make the environment safe. Let's make environment conducive. And let's make the environment accessible. Thank you once again for joining me. Don't forget to like this channel, subscribe to it, share that others might see it. Till we meet again, to remain blessed and remain in the presence of the Most High God. Thank you.